What if the person in charge of protecting your family's future didn't trust the science behind vaccines, technology, and public health policies? Would that make you feel safer or more scared? It's important to consider the points we'll raise in this video. Robert F. Kennedy Jr. has a polarizing reputation. Some see him as a crazy crackpot, while others say he's a guy who makes sense. I'm a guy who likes to dig into issues, do the research, and find out what the truth really is. And I've done the research for you. My notes are in the video description if you want to review them and take a deeper dive when we're done. So stick with me until the end of this video and you'll walk away with a clear, balanced view of RFK Jr., his vision, his controversies, and his potential impact. By the time we're done, you'll have everything you need to form your own informed opinion about whether his leadership would be revolutionary or reckless. Hi, I'm Steve, your guide here at Old Guy Insights, and together we'll unpack RFK Jr.'s bold and controversial vision for public health and ask, would his leadership transform the system or turn it upside down? Grab your coffee, get comfy, and we're going to figure this out together. Hey, before we dive in, don't forget to like this video, subscribe to the channel, and boop that notification bell so you don't miss out on future insights. And if you want to share your opinion on this topic, head over to my community tab where I've got a poll running. You can cast your vote and let me know where you stand on RFK Jr. Let's start with the most contentious and combustible issue, vaccines. RFK Jr. has spent decades questioning their safety, linking them to autism, a claim thoroughly tested and thoroughly debunked by the Centers for Disease Control and Prevention, CDC, the World Health Organization, the WHO, and a mountain of peer-reviewed research. As HHS Secretary, that's the head of the Department of Health and Human Services, he'd likely push for stricter safety screenings, more transparency, and a reevaluation of the current vaccination schedule. So take a moment to reflect. If vaccine programs were scaled back, would you feel empowered by greater choice or alarmed by greater risk? Critics caution that Kennedy's crusade against vaccines clashes with the overwhelming scientific consensus that vaccines are safe and effective and essential. They warn that his leadership could cripple confidence in vaccination programs, leading to lower vaccination rates, outbreaks of preventable diseases, and harm to the very people vaccines are designed to protect. But Kennedy's concerns don't stop at vaccines. He's also voiced skepticism about public health mandates, such as mask requirements and COVID-19 protocols. These stances could pit HHS against evidence-based practices, potentially fueling confusion and fracturing trust during public health crises. Picture a world where pollution isn't just tolerated. It's tackled with tenacity. Cleaner air, safer water, and fewer toxins in our everyday lives. I mean, sign me up, right? RFK Jr.'s environmental advocacy is nothing short of remarkable. He's fought against mercury contamination, pesticide overuse, and industrial pollutants with passion and persistence. But here's the paradox. While his focus on environmental health could bring overdue reforms, it might also pull precious resources away from other pressing priorities. I mean, think about the opioid epidemic, which is ravaging communities, or mental health services that are stretched to the breaking point. Critics caution that Kennedy's leadership could divert dollars, direction, and determination away from these urgent health challenges. And let's not ignore the economic angle. I mean, stricter regulations often spark resistance, raising costs for businesses and eventually for you and me. So the question becomes, are we ready to pay a higher price for a healthier planet, even if it means sacrifices elsewhere? Now here's where things get especially divisive. RFK Jr.'s concerns about 5G, the fifth generation of wireless technology, and electromagnetic fields, or EMFs. He claims these technologies could pose hidden health hazards, demanding more studies and tighter controls. But government agencies like the Food and Drug Administration, the FDA, and the Federal Communications Commission, the FCC, maintain that current science doesn't substantiate those fears. So here's the sticking point. Are we being prudently cautious or wildly paranoid? And let's be real, who's giving up fast Wi-Fi even if your router was somehow emitting some signal? Would most of us say, yeah, but those download speeds are worth it? Still, critics raise serious concerns. Could Kennedy's focus on 5G and EMFs become a distraction from deeper dilemmas like addressing maternal health disparities or tackling rising rates of chronic illness? Worse yet, his controversial claims might strain relationships with global organizations like the WHO, jeopardizing international efforts to combat pandemics and eradicate diseases. Let's tackle the elephant in the room: misinformation. Kennedy's track record on promoting discredited theories has drawn fire from scientists, doctors, and public health officials. If he took the helm at HHS, critics fear he might amplify unverified and unscientific claims, sowing confusion and mistrust. And here's why that's dangerous. Trust is the backbone of public health. Without it, policies fail, misinformation flourishes, and lives are lost. Imagine a world where half the population questions every public health initiative, not because of the science, but because of the speaker. Even more concerning, experts warn that Kennedy's leadership could lead to a mass exodus of seasoned scientists and health officials, leaving HHS weakened and demoralized. How can a ship stay afloat if its most skilled navigators jump ship? So how do we decide? Let's weigh the potential upsides and downsides. Does his vision align with your values? If you prioritize personal freedom and distrust large institutions, Kennedy's ideas might sound liberating. What's the cost of conflicting with science? His skepticism about vaccines and health measures could hinder public health efforts, risking preventable tragedies. Can HHS stay effective? Internal strife, staff resignations, and global tension could undercut the agency's mission. And what's the bigger risk? Bold change or sticking to the status quo? If you believe public health needs a shakeup, his focus on transparency and environmental health might feel refreshing. But if you prefer stability, his leadership might seem reckless. Now, this isn't just a thought experiment. It's about the kind of healthcare future we want for ourselves, our families, and generations to come. RFK Jr. isn't just a name in the headlines. His leadership could reshape public health, redefine freedom, and challenge the way we approach science itself. But would it bring bold solutions or unintended consequences? What's your take? Is RFK Jr. the disruptor that we need, or are his ideas maybe a step too far? Let me know in the comments. I'd love to hear your perspective. And don't forget, like the video, subscribe to the channel, and boop that notification bell so you don't miss out on future insights. And while you're at it, head over to that community tab and cast your vote in the poll. I really want to know where you stand on this subject. And if you're still here, great. Click the next video right here to see how things are shaping our world. And thanks for hanging out with me on Old Guy Insights. Until next time, stay awesome, stay informed, and do good things. See ya.